It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In the last blog, I talked about part 2 of You Don't Know What You Don't Know when your loved one is critically ill in intensive care. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to share with you how to cope when your loved one is critically ill in intensive care. Before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "Having a loved one critically ill in intensive care is one of the biggest challenges you and your family will encounter in your entire lifetime. In fact, having a loved one critically ill in intensive care is a once-in-a-lifetime experience that you simply can't afford to be getting wrong. Knowing how to cope and how to get results when the stakes seem insurmountably high is a very good life skill to have. Knowing how to make informed decisions, get peace of mind, control, power, and influence when intensive care teams have quote-unquote expert status, when they have perceived power and perceived authority, is very difficult, especially in the absence of good role models and perceived options. Feeling intimidated by intensive care teams and not knowing where to start doing your own research and seeking for your own truth and wisdom is adding more complexity to the situation. Feeling under pressure by externally imposed deadlines from intensive care teams about life or death decisions is the ultimate negative pinnacle of this worst ever possible nightmare. Knowing how to cope and knowing where to find help, advocacy, counsel, and consulting is going to help you tremendously during this high stakes and once in a lifetime situation. So let's get into today's topic. Did you know that the change in the health status of a family member is in the top 10 of the most stressful life events? This change in a health status of a family member as being one of the most stressful events in life doesn't refer to critical illness. It just refers to a change in the health status of a family member. This could be anything: a flu, a broken leg, or a mental health issue, or something else. How do you think the change in the health status of a family member compares to a critical illness? Well, the change in the health status of a family member sounds pretty benign compared to a critical illness, as far as I'm concerned. Most families in intensive care who come to us at IntensiveCareHotline.com do so when their loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or they're not waking up after an induced coma, or they're in intensive care for long-term treatments and long-term stays, including long-term ventilation, or they may be having a severe or traumatic head or brain injury, or they may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or your loved one may be in a situation where the intensive care team suggests that a withdrawal of treatment or a limitation of treatment might be, quote unquote, in the best interest for your critically ill loved one, or your loved one may be approaching the end of life in intensive care. So, how do those high-stakes situations that I just mentioned compare to the change in the health status of a family member? Those high-stakes situations are way more challenging compared to a change in the health status of a family member, as far as I'm concerned, because those situations are literally life or death situations. And they are seemingly situations where you and your family need to find coping strategies, and you need to find them fast. The good news is that you have come to the right place for the right strategies, advice, and advocacy if your loved one is in intensive care. But just as important as the coping strategies are the strategies that you talk to and negotiate with the intensive care team on a similar level. The reality is that if you are doing what 99% of the families in intensive care are doing, you will be intimidated by the intensive care team and you won't make informed decisions, get peace of mind, control, power, and influence. In order to cope, you need to believe that you can cope. You need to believe that you can turn things around, and you need to believe that you can speak to the intensive care team and get what you want, need, and deserve. Not believing and not acting on any of the above will get you and your family in big trouble. In order to do so, you need to start doing your own research. You need to start acting differently compared to what 99% of the families in intensive care are doing, and you need to question everything. You also need to start changing your body language when you're going into intensive care. You may ask, why do you need to change your body language? Well, the reality is because you need to change the vibe you're giving off. Don't walk into intensive care like 99% of the families in intensive care who don't cope and to continue to be intimidated by the intensive care team. They walk into intensive care with their head down, with their shoulders hanging down, with their backs hunched, and they are avoiding strong eye contact. You really need to think about every aspect when your loved one is critically ill in intensive care. And this includes yourself and how you carry yourself, how you talk, how you walk, and also if you believe you can have an impact so that you stay in control of your critically ill loved one's fate and destiny. And you may wonder why I should be the one telling you about how to cope when your loved one is critically ill in intensive care. And that's a fair question to ask. And I can assure you that after nearly 20 years intensive care nursing experience in 3 different countries, where I literally worked with thousands of critically ill patients and their families, where I also worked as a nurse unit manager in intensive care for over 5 years, and now in my one-on-one counselling, consulting and advocacy service here at intensivecarehotline.com, I know of the struggles you and your family are facing intimately. I also had to find my own coping strategies whilst working in intensive care, especially when dealing with death and dying and other trauma. I know firsthand that it's not easy, but you've come to the right place because I overcame my own struggles whilst I was also losing my uncle at the age of 51 in intensive care, and he died because of cardiomyopathy at the time. I was only a teenager then, but I do remember it vividly, and it was terrible. So I have a good understanding of how you feel when your loved one is in intensive care. To give you more practical advice in order to cope when one of your family members is in intensive care, keep in mind that the intensive care team is almost always going to be negative. You also need to know and understand rather quickly that what you see is not always what you get in intensive care, and you need to know and understand that you're in a high stakes game. This quote unquote high stakes game is stacked in the intensive care team's favor if you don't know how to play, so to speak, and if you do what 99% of the families of critically ill patients in intensive care are doing. In order to cope when you have a loved one in intensive care, you need to also very quickly understand that intensive care is a finely tuned machinery, and you need to know and understand that what's happening in intensive care is mainly driven by what's happening behind the scenes in intensive care. What's happening behind the scenes in intensive care is what's driving the negativity of the intensive care team, and it's also what's driving the positioning of your critically ill loved one's diagnosis, prognosis, as well as the care and the treatment the intensive care team is offering or not offering. Therefore, it's of utmost importance that you'll get professional help quickly when it comes to positioning your critically ill loved one's diagnosis, prognosis, as well as their care and their treatment. If you are failing to do this, the intensive care team will stay in control of the meaning and the outcome of your critically ill loved one's fate and destiny. The intensive care team knows what to say, they know how to say it, they know when to say it, and they know what not to say. They have scripted everything way in advance, and you have no idea what's coming next. They have been doing this for years, and they do it day in and day out, 365 days, 24 hours a day. If you're not prepared for this quote-unquote high-stakes game, and if you're not doing your own research, change your thinking and your belief system rather quickly, you won't stand a chance. You certainly don't want any of this, and that's why it's so important that you do your own research fast and that you get professional counseling, consulting, and advocacy so that you stay in control of the meaning of the situation as well as the fate and the destiny of your critically ill loved one. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? Well, you get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again next week in another update. Make sure you also check out our Your Questions Answered section where I answer your questions, or simply send me an email to support@intensivecarehotline.com with your questions. or you can call me. Find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone and via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.